Wondering if your back pain is from a disc or muscle issue? In this video, I'll be answering how to tell if your back pain is due to a disc or muscle issue, and what are some of the at-home solutions to relieve back pain. Remember, this is just a suggestion and to give you a general understanding, so if symptoms are severe, persistent, or you have numbness or weakness, you should seek your healthcare provider's help. Make sure you watch to the very end for a quick self-test that I hope you find helpful. So let's begin. How can I tell if my back pain is due to a disc or muscle issue? I'm going to talk about the back area because of the disc issues usually happen there, but it doesn't have to necessarily be in your back. It can include your neck or your mid-back spine as well. At the beginning, both disc and muscle issues can be very painful. Disc-related pain often affects the lower back and may radiate down one leg, indicating nerve involvement. It can also feel sharp, stabbing, or burning, whereas muscle pain tends to be localized in the area of strain and feels more like a dull ache or tightness. It typically doesn't really radiate to the legs. Disc pain often gets worse with standing forward or bending forward, sitting, or extending your back, or basically for a long time, or lifting heavy objects, since they increase pressure on the disc. Muscle pain is usually aggravated by specific movements or positions that stretch or engage the affected muscle. Muscle may feel better with rest and gentle stretching or heat, but not moving can also make it stiff. Disc pain can persist even with rest, and sitting might actually make the pain worsen because of that increased pressure on the disc. Pain from a disc problem can start suddenly or gradually, typically after bending or twisting or lifting awkwardly. The pain can actually get worse over time because of the pressure over the nerve. With muscle pain, it's usually sudden, following an injury, heavy lifting, or overuse. It can improve over days or weeks, depending on severity. If a disc is pressing on a nerve, there may be numbness, tingling, or weakness in the leg or the foot, or if it's in the upper extremity, In case of muscle pain, we generally don't see numbness, tingling, or weakness. So now here's a quick self-test that you can do at home, but remember, if symptoms are severe, persistent, or with numbness or weakness, you should see your healthcare provider. So now let's go ahead and lay down on your back. And what you want to do is you want to lift your leg up on the side that you have issues with. If you lift your leg up like so, and you feel pain, increase in pain versus tightness in the back of your legs, increase in pain when you lift your leg up is typically could be an indication of a nerve problem or a disc problem. Whereas if you feel that stretching in the back of your leg, it's typically that muscle tightness that you're having. Keep in mind that without imaging or proper assessment, there really isn't a definitive diagnosis. It's just something that kind of puts your mind at ease or gives you a heads up even more. Hope you found this video helpful. Comment below with your questions, and if you know any issues or you have any issues and you need some help, make sure you contact me. You know where to find me. Until next time, take care.